Welcome back. Now, some independent pharmacies are still without payment for COVID-19 vaccines administered during the pandemic. The two-year battle fuels anxiety about the financial implications of providing services to the state under the NHI. Jackie Maimin, CEO of the Independent Community Pharmacy Association, joins us with more detail. Thank you so much for your time, Jackie. Now, let's just track back a little bit here. What was the original agreement between the state and pharmacies on COVID vaccines and payment terms?
Okay, so you'll remember during the pandemic, we were sort of left behind when it came to vaccinations. So there was a mad scramble to get as many sites vaccinating as possible. So the Department of Health reached out to the private sector to say, look, we're already behind. We need to get the population vaccinated as quickly as possible. So there was many hours of meetings, there was training, we had to gear ourselves up. And in the end, I think there were 1,700 odd private sites that partnered with the Department of Health to deliver these vaccines. Obviously, getting some sort of agreement in place was done very rushed. And that agreement stated that we had to, that the sole provider of the vaccines would be the Department of Health, that we would purchase vaccines at a price set by them, and that we needed to administer those vaccines, charging, if it was an insured person, charging the medical scheme, the cost price of the vaccine, and if it was the state, that they would pass a credit for that. In addition, it was agreed that a cost recovery administration fee would be charged, and that was 70 Rand. And again, that 70 Rand would be charged to the medical scheme, or a credit would be passed against the cost of the vaccines from the side of the government. The sales and distribution agreement said that once we accepted stock, that stock became our responsibility to maintain cold chain, to ensure there were no wasted doses. And of course, the agreement also said we had to record everything on the electronic vaccine data system.
Where now is the conflict?
So there's a couple of issues. So the first thing, I think, is the fact that at the end of the vaccination, and many of our sites stopped vaccinating at the end of 2021, going into the beginning of 2022. That's when the demand really started to drop off. So the first conflict came that there were 28 pharmacies that had vaccinated predominantly uninsured people, which meant that the Department of Health owed them money. All right. So the first thing was that these pharmacies obviously needed to pay nurses. You remember the administration fee was just a cost recovery. So we had to pay for syringes, we had to pay for venues, outreach, and all the rest of it. So that was the first thing. Our one pharmacy in a rural area that had done outreach to all the farms was owed 2.5 million Rand. And they were eventually paid. They were paid in May 2024. And that money was owed to them since the end of 21. So you can see for a small rural pharmacy to carry that kind of debt for that long, it severely impacted them. Of the 28 pharmacies that were due money, more than half of them have still not been paid. The next dispute was, for quite a long time, we indicated that the tray size was large. It was a significant financial risk to take these vaccines on. And we said to the Department of Health, you control demand. People come to us through the EVDS, and that we felt that if vaccines, because remember as well, in terms of the sales and distribution agreement, we were not allowed to sell vaccines. So once we had accepted them, if we found the demand was not going to use them, we had to get back to the control tower and say to them, these vaccines are going to expire on us. Can you try and move them? And when we did that, the control tower came back to us and said, no, we can't. Nobody wants the vaccines. So they expired on us. Now, sometimes it was hundreds of thousands of rands. So we said to the Department of Health, the intention was never for us to take the risk of vaccines expiring. our risk was to make sure that they were not wasted and that cold chain was maintained. The Department of Health then said, no, in terms of the SDA, you are liable. Those vaccines expired on you, and it is for your cost. Now, a J&J tray is 688,000 Rand. And if we can't get people to give the vaccines to, we're expected to foot that bill. And I know the department wrote off millions of vaccines, but what we're saying is the department is now putting that financial loss onto the private sector, which we feel was not in the deal.
So then I understand that I'm sure you've had many conversations with the department, but obviously there is no resolution. Is the only resolution now through the court system, and what's that looking like so far?
Yes, so yes, we've had many meetings. We even asked B4SA to come and assist us. Unfortunately, they could not assist us. One of our members who is very unhappy with the system, can't even pay his staff, has gone to the public protector. So we're waiting for that to wind up. What we are looking at, and one of our worries is that this debt, you'll know that debt after 3 years can be prescribed.
Yes.
So we can't allow that to happen. The pharmacies that are owed money. So we will go to court over these issues, and we will argue the fact that the risk of those expiring through no fault of ours should not be carried by the private sector. Effectively, the government, it was their responsibility to vaccinate the population, and to now offset some of their losses against us is unfair. And we will take this to the courts.
Thank you so much for enlightening us on that, Jackie. I mean, from, the normal person on the ground, COVID-19 may have ended, but it's quite, discouraging to see some of the issues that are going on behind the scenes of things not being resolved between the private sector and the government. And really, I can understand the anxiety that it induces in terms of partnering with the government on the NHI. So, of course, we are going to be keeping a very, very close ear to the ground on this. That was Jackie Maimin, CEO of the Independent Community Pharmacy Association.